Now we're moving forward, we're trying to look at the next bone here, which will be discussing its anatomy. So this is what is known as a sternum, the anatomy of the sternum. So for the sternum, what you got so far is this. You should just know that the sternum is a flat, it's an elongated bone. It's located in the center of the anterior thoracic wall. Okay, so it forms the front of the thoracic cage. So if you are talking about the thorax having a cage, this is what is kind of like what? A point where all the cartilages are actually kind of like inserting and making the cage hold. So part of the sternum, we have the manubrium, we have the upper portion of the sternum. Manubrium is the upper part, right? Sorry. Next, okay, articulates with the clavicles. It forms the sternoclavicular joints. Then also contains a jugular notch. Okay. Then yeah, we have the body, which is also known as a gladiolus. Okay. Of the body, which is the gladiolus. So coming. So the body is long. Okay. Articulates with what? 2 to 7 ribs. Okay, 2 to 7 ribs. Then I think that's what we got. It joins to the manubrium at the sternal angle of Lewy. Okay. And what next? Also have the Xiphoid process. Okay, Xiphoid process is like pointed end that is there. Okay, so provides attachment to, you know. So functions is basically for protection. It shields all those vital organs, you know. Support serves as a central attachment point for ribs, you know, clavicles. Landmark is used clinically. It's used clinically to locate ribs and guide medical procedures. Then clinical notes, sternal angle, which is a key landmark for counting ribs. So if I count from here, if I count and stop there, I know that, okay, yeah, that's where, you know, a particular number of ribs are. So fractures, sometimes in all those traumatic fractures, you could be affected. And all those CPR, what you are pressing on the chest is actually the sternum. Okay, what you are pressing on the chest is the sternum. So bone marrow aspiration too. So it's also a site for, you know, bone marrow aspiration. I think that's what we got for the sternum and its clinical anatomy.